Well, I'm Coleman Driver, and I'm an ophthalmologist. I do retina and vitreous surgery, and I have been doing this kind of surgery for about 30 years. During the last 4 or 5 years that I was doing surgery, I started having some problems with numbness, occasional numbness in my thumb, and also started having some pain. And I had been told that I had a disc problem in my neck. And during that period of my life, I didn't want to have surgery because I was afraid that I would not be able to practice anymore. I delayed having surgery for about 2 years. During that time, I noticed progressive loss of function in my muscles in the left arm. And I got to the point where I could actually see muscle wasting, where my right side was just as full and just as strong as ever, but the left side was getting progressively weaker.
Oh, my husband 3 years ago, he's a surgeon and had some neck problems in the past. And we were playing racquetball and whatnot, and he was telling me that when he would look up to swing at the ball, that his arms would both go numb and have pain down both arms.
It became not an issue of whether to have surgery, but when to have surgery.
I had known Dr. Ramsey for years, and I said, you know, I would recommend that you go speak to Dr. Ramsey and be examined. And my husband went and saw Dr. Ramsey and elected to have surgery.
And after a brief discussion with him and seeing how he did the surgery and then doing some at-home analysis about what I thought of that kind of surgery, I decided that that would probably be the best for me. And I'm really happy about that because I had the surgery on Thursday and I was back to work on Monday.
I am turning 40 this year. My husband is about 26 years older than I am, and we're very active. We walk every night. We play volleyball. We play beach volleyball. We hike Mount Vesuvius. We are very active, and for us, that's very important to continue to do the things that we enjoy.
The pain was gone. It was like a miracle because not only did I not have the loss of sensation in my fingers, but I also began to have muscle function return. So my strength began to return and the pain went away. I never had excruciating pain during the entire course of the disease, but it was kind of a nagging, aching injury that you don't know that you have it until it's gone, and you say, "Oh, boy, that feels better," you know. And I tell you, it made a big difference in my life. So, you know, I can't speak for other people, but I can tell you that for me, this was the best possible outcome. My wife, as you've met earlier, Jolene, she also had some neck problems. It seems to be endemic with our type of activity, or our type of. I've had a number of other doctors in my profession, eye surgeons, and it may be the equipment that we use or the type of lifestyle that we have, but very many of these people develop neck problems, disc problems, and Jody was one of those people that developed that kind of problem too. After I had my surgery 2 years later, she developed similar symptoms.
I practice ophthalmology, and I do a lot of, when I'm examining patients, there's certain positions with my head that is not considered a neutral position, and so I put my head in certain positions and looking through the microscope in surgery, and I wasn't able to do that. I was very, very limited before surgery. I had one position that was comfortable. I really, it affected my activities that I did every day. I was playing volleyball with my daughter, and I spiked the volleyball at her, and as I hit the ball, I must have turned my neck just right, and I herniated 2 discs in my neck. And I had surgery with Dr. Ramsey approximately 2 months ago. Dr. Ramsey told me that I would be able to return to my normal activities as I felt like I could. It was much easier than even I expected. I had surgery on Wednesday, and then I went back to work on Thursday. I worked 4 hours Thursday afternoon. I didn't take any pain medicine. I was back in the operating room assisting the next week, comfortably at the microscope with no problems. Of course, there was a little bit of tenderness in my neck area, but as far as the pain that I had with the injury, there was no comparison. I felt a lot of relief, and I was just very happy. I woke up and went home, and I just was better immediately. And then I was pretty much back to running and playing volleyball and riding my bike. And at about a month out, I just started competitively playing volleyball again at about 6 weeks with no problems, no pain, no residual.
Well, Dr. Ramsey's procedure is innovative. For some reason, the healing process is quicker that way, and it seems to fix itself much more rapidly.
Before surgery, I was very worried because I love my life. I love what we do, and I can't imagine not having had the surgery done. I can't imagine, when I think about people that haven't had the surgery and they're living with this pain, I just can't stress enough how important it would be to go ahead and have the surgery, have the results, and